Attention Deficit Hyperactivity Disorder, ADHD, is a condition that affects people's behavior. People with ADHD can seem restless, may have trouble concentrating, and may act on impulse. It's estimated that approximately 10% of children and 4% of adults worldwide have ADHD. Symptoms of ADHD tend to be noticed at an early age and may become more noticeable when a child's circumstances change, such as when they start school. ADHD is characterized by symptoms such as inattention, hyperactivity, and impulsivity. Examples of these in children might be having a short attention span and being easily distracted, making careless mistakes in schoolwork, appearing forgetful, or losing things, being unable to stick to tasks that are tedious or time-consuming, being unable to concentrate on tasks, and excessive talking. Examples in adults might be carelessness and lack of attention to detail, continually starting new tasks before finishing old ones, poor organizational skills and forgetfulness, difficulty keeping quiet and speaking out of turn, blurting out responses and often interrupting others, a quick temper and extreme impatience. If you or a loved one has ADHD, it's essential to seek proper diagnosis and treatment. Make sure you speak to your doctor. ADHD can be treated using medicine or therapy, but a combination of both is often best. With the right support, people with ADHD can thrive and live a healthy and happy life. One way to manage ADHD symptoms is by developing a routine and sticking to it. Breaking down tasks into smaller, more manageable steps can also help. Remember, having ADHD doesn't mean you can't lead a successful and fulfilling life. With the right support, you can achieve your goals and thrive. We hope you found the information in this video useful.
Life can feel like a constant juggling act, balancing work, relationships, and personal goals. But for individuals with ADHD, this juggling act can feel overwhelming. Today, we're diving into what ADHD is, its symptoms, causes, and the treatments that can help manage it. ADHD, or Attention Deficit Disorder, or also known as hyperactivity disorder, is a neurodevelopmental condition that affects both children and adults. It's characterized by persistent patterns of inattention, hyperactivity, and impulsivity that can interfere with daily life. But ADHD isn't just about being easily distracted or hyperactive. It's a complex condition that manifests differently in everyone. Let's break it down. The symptoms of ADHD fall into three main categories: inattention, hyperactivity, and impulsivity. Inattention might look like difficulty staying focused, being easily distracted, or struggling to complete tasks. For some, it's forgetting appointments or losing important items. Hyperactivity often presents as constant movement, fidgeting, or feeling restless. In children, this might mean running or climbing excessively. In adults, it could look like an inner sense of restlessness. Impulsivity can lead to hasty decisions, interrupting others, or acting without considering the consequences. These symptoms can vary in severity and often overlap. So, what causes ADHD? While the exact cause isn't fully understood, research suggests a combination of genetic, neurological, and environmental factors cause ADHD. Genetics plays a significant role as ADHD often runs in families. Brain imaging studies have also shown differences in the structure and activity of certain brain regions, particularly those involved in attention and impulse control. Environmental factors, such as exposure to toxins during pregnancy or early childhood, may also contribute. However, ADHD is not caused by poor parenting, too much screen time, or a lack of discipline. The good news: ADHD is manageable. Treatment typically involves a combination of medication, therapy, and lifestyle adjustments. Stimulant medications like methylphenidate or amphetamines are commonly prescribed to help improve focus and reduce impulsivity. Non-stimulant options are also available for those who don't respond well to stimulants. Therapy, such as cognitive behavioral therapy, can help individuals develop coping strategies and improve time management. Lifestyle changes like regular exercise, a healthy diet, and structured routines can also make a big difference. Living with ADHD isn't without its challenges, but with the right support and strategies, individuals with ADHD can lead fulfilling, successful lives. If you or someone you know is struggling with ADHD, remember, you're not alone. Reach out to a healthcare professional to learn more about diagnosis and treatment options. Together, we can create a world that understands and supports everyone, no matter how their brain is wired. Thanks for watching. We hope you found the information in the video useful. Have you ever found it harder to focus as you've gotten older? Trouble starting tasks? Forgetting things constantly? You may have wondered, is this burnout, aging, or could it be ADHD? Age-acquired or adult-onset ADHD refers to symptoms of Attention Deficit Hyperactivity Disorder that appear for the first time in adulthood without a childhood history of the condition. For some, these symptoms emerge in their 30s, 40s, or even later. While classic ADHD is often diagnosed in children, some adults begin experiencing attention issues, impulsivity, or restlessness much later in life. Here are some of the most common signs of age-acquired ADHD. Symptoms often include inability to focus or finish tasks, easily distracted by minor things, memory lapses, restlessness or inner agitation, poor time management and disorganization. So what causes ADHD to appear later in life? The truth is, we're still learning. But some possible factors include chronic stress or burnout, hormonal changes, brain injuries, undiagnosed childhood ADHD that flew under the radar, neurodegenerative or mood-related changes. Getting a diagnosis as an adult can be tricky. Doctors will review your current symptoms, look at your history, and rule out other issues like anxiety, depression, or menopause. If diagnosed, treatment may include medication, like stimulants or non-stimulants, cognitive behavioral therapy, coaching or productivity tools, lifestyle changes. Struggling with focus doesn't mean you're lazy, careless, or getting old. It might be something deeper and treatable. If you suspect age-acquired ADHD, talk to a healthcare professional. Awareness is the first step toward clarity, control, and confidence.